Hello and welcome to National Focus. I'm Pearl Fontaine. Thank you for joining us. In the headlines, HIV/AIDS counselors empowered to make a difference. The Registry Department nears total digitalization, and Mary Angle joins the long list of centenarians on the island. Stay with us for more after this break.
If you can believe this,
come by my house and let me show you some movies.
why can't you believe this? Some mothers don't believe their own children when they say they've been sexually abused, and they don't report it. Remember, if anyone asks to see or touch their private parts, touches them inappropriately, shows them or forces them to touch one's private parts, has sex with them, shows them pornographic material, or deliberately lets them hear or see the act of sex, then it is sexual abuse. Believe your child and report the sexual abuse. For more information about child abuse, contact these agencies. This message brought to you by UNICEF and this station.
Welcome back. Topping the news, the Registry Department is almost fully digitalized and will soon be issuing secured birth certificates and civil documents. GIS News spoke with Acting Registrar Ozzie Walsh and learned that with help from the Organization of American States, important steps have already been taken and completed.
For the issuing of certificates, all certificates, birth, marriages, adoptions, and death certificates issued electronically. The staff here has been trained for that. I've gone for the training process too, so my deputy has. We all have gone for the training process. Here, the Canadians came down, had the training program done sometime in October, from a month and a half ago, to be able to use the system.
According to him, the OAS has provided technical and personnel support to digitalize the civil registry. So far, all of the books, over 150 of them, have been scanned and logged into a computer networking system. Staff is currently engaged in computerizing other documents of the Civil Registry Department. While the system is being tested by the ICT office at the Registry Department and the Princess Margaret Hospital, where most births are registered, staff continues issuance manually.
We produce about 150 certificates a day from here, and it's a lot of writing. There are about 4 members of staff just writing, going on the computer, searching for the names, going to the books, searching the books, and then writing is a lot of work, 150 certificates every day. So we cannot produce all those things one time. We're telling you to come back in 2-3 days' time. So it will mean a major transformation here for us at the registry, where you will have persons being able to be serviced, members of the public, much more expeditiously. And we want to deliver better service to the public.
Eventually, all unsecured birth certificates will be phased out. On completion of the entire process, the documents which will be issued by the Registry Department will be drastically improved.
The project is well on its way, and I'll be happy to announce as registrar to the public that they'll soon be able to obtain certificates from the registry swiftly and via the computer. Press the button. Of course, you obviously have to pay more for it, and you're not going to get this sort of service from the registry. Government, such a fantastic investment, a huge investment, without paying some more for certificates. The cabinet will have to decide how much more certificates will cost the general public. The good news is a birth certificate, which is now horizontal. That's what a birth certificate looks like. When the new birth certificate is being issued, it's being issued by the computer, it will be this way. It will be vertical. This is unsecured paper, so anybody can fudge it. So this is written. This is manually produced. The new birth certificates that's locked in our vault. We have 100,000 sheets of secured paper. They're on specialized paper. The paper is one that they were printed in Canada. They were produced in Canada. They are blank on blank sheets, but they have security features like money. It's a very expensive paper, and persons obviously have to pay some more for it, because the new birth certificates will be almost, I like putting it this way, almost unfudgeable.
This move to digitalize the registry department is part of a much larger one to move to a fully electronic government system in Dominica and the region. Other government departments are also being digitalized at this time. In more news, HIV and AIDS counselors from various parts of Dominica have been given practical skills which will assist them in carrying out their functions more effectively. Last Friday, counselors received certificates of completion signaling the end of a 5-day training program organized by the National HIV and AIDS Response Program. The newly trained counselors are now better able to perform HIV/AIDS testing and engage in counseling sessions with patients. Facilitator Mary Williams is optimistic that the training has imparted new knowledge to participants. She called on the counselors to embrace professionalism at the job at hand.
Let us put ourselves in the place of our clients. Let us be compassionate, patient, and non-judgmental as we provide this much-needed service to our clients. Once again, let me say to everybody, welcome.
PAHO's country specialist Shirley Augustine is also hoping to see a positive change in behavior as a result of the training program.
You have been empowered over the course of this last week, and I am hoping that you go out there and you make a difference. That is the important thing, making a difference so that we in turn can see a change in behavior. When people have learned, when learning has taken place, you're supposed to see a change in behavior.
The PAHO specialist spoke specifically to the needs for counselors to respect patients' privacy and exercise confidentiality at all times.
There are some people who will talk to you who might not talk to anybody else. But with that openness comes a certain amount of responsibility. And anything that relates to the sexual part of us as human beings is usually very private, although privacy is going out of style now. It's usually very private, and people are often afraid to speak because they do not want to hear somebody else repeating what was said in confidence. So I hope the issue of confidentiality that I'm sure was discussed during the course of this week remains with you. Because if you are going to be speaking to people, you need to learn to keep whatever was said to you in strictest confidence.
Dominica's Chief Medical Officer, Dr. David Johnson, also addressed the certificate presentation ceremony. We'll bring you more excerpts from his presentation in a subsequent newscast. The new leadership of the City of Roseau, led by Her Worship Irene John, intends to release a plan of action relating to projects on its agenda. At the inauguration of the 13-member council last Friday, Mayor John outlined the items considered urgent. She listed dilapidated buildings and sidewalks, the issues of vagrancy and parking, and the safety of sanitation workers as matters needing immediate attention. Other items to be tackled in the medium term will be outlined and released via a program of action.
The other plan for the city will be outlined in a program of work to be developed by the members of the council who are familiar with the problems plaguing the city. In developing such a program of work or plan of action, the council will build partnerships with the government, private sectors, trade unions, non-governmental agencies, and the civil society. Obviously, the council will not be able to do all what is required on its own, and assistance will be sought from contributors who share a common vision for the city.
As affirmed by the Finance Minister, Prime Minister Honorable Roosevelt Skerrit, the program of action will receive government's full support. In his remarks at the inauguration, the Prime Minister listed matters which he believes requires attention from the City Council. Among those items, sidewalks, drains, and housing assistance were listed. The issue of vagrancy, which Honorable Skerrit describes as a societal issue, is being tackled from government's level.
We have spoken about the issue of vagrancy, and the Ministry of Health and Tourism and the other stakeholders have met There's a proposal towards addressing this. I would urge the Council to engage these two ministries with a view to playing its part in addressing this challenge. But addressing the vagrancy is a societal challenge because there are laws in the country and one cannot unlawfully detain a citizen of the country. And we have to now get the families involved because every one of the persons you see walking the streets, most of them, they have a family. And how do we get the family to play its part in assisting the state, assisting the city in addressing this social challenge?
Look out for more from that event in subsequent newscasts. In keeping with the United Nations Decade of Action for Road Safety 2011 to 2020, Dominica's Ministry of Health on Monday, December 16, hosted day one of a two-day training exercise for post-crash response first responders. The objective of the exercise was to strengthen the skills of the island's emergency services first responders to improve on their management of post-crash response cases. The training exercise, facilitated by Dr. Mallet Marie, is being conducted in collaboration with the Ministry of National Security, Immigration and Labor and the Pan American Health Organization. The training exercise forms part of a draft strategic plan which was developed by the island's health ministry to assist in stabilizing and reducing the number of road traffic crashes, injuries and fatalities on the island. Alison Samuel of the Health Promotion Unit, in addressing the opening ceremony, said that plan highlights 5 pillars under which activities have been planned. She outlined the objectives of the pillar, which deals specifically with post-crash response.
To have a structured, integrated pre-hospital care system in place for persons with traffic injuries and to improve crash-to-theater time for seriously injured individuals requiring surgical intervention. One of the indicators in accomplishing these objectives is to have improved access and availability of trained emergency response teams and ultimately have an increased number of trained personnel in trauma care.
Samuel noted that this week's training exercise will be the first of several to be held throughout the island.
This first training will focus on you, our trained personnel, but we hope to be able to continue this training throughout communities so that we can have a cadre of trained first responders across the island.
National epidemiologist and focal point for road safety in Dominica, Dr. Paul Ricketts, revealed that statistics indicate road traffic crashes affect the most productive age group in Dominica. He said about a quarter of these deaths involved motorcycles and 1/5 of the road fatalities were pedestrians. He stressed the importance of these numbers being significantly reduced.
The loss of life of a single individual in Dominica is very significant, not just for the individual and the family, but for the nation as a whole, because this is an individual who potentially or is a contributor to national development and is potentially a leader in the future of the social and economic development of Dominica. So we really can't afford to be losing our young people to preventable causes such as road traffic crashes.
Day 2 of the training program is scheduled for Wednesday, December 18, 2013 at the Office of Disaster Management in Jimmet. The increase in the prevalence of non-communicable diseases has negatively affected many. However, there is something special in Dominica that keeps us living long. The list of centenarians keeps growing. Let's join Kimani Sejan for a report on the latest centenarian to join the group.
70 is what we are promised. However, Mary Angol of Grand Colibri is the 30th individual of an elite class of Dominicans who have defied that. On September 11, 2013, Mary Angol celebrated 5 scores. On Monday, President of Dominica, His Excellency Charles Savre, along with Mrs. Savre, Acting Prime Minister Honorable Reuben Blackmore, Minister for Social Services Honorable Gloria Shillingford, Minister for Culture Honorable Jessica Charles, and several others joined Marie and her family and friends in celebration of her 100th birthday. A mass was celebrated in her honor at her residence. The relatives of Marie were complimented for the proper care of their beloved over the years. President of the Dominica Council on Aging, Zetma Toussaint, took the opportunity to make an appeal for younger persons to follow the examples of Marie's family and bridge the generation gap by taking care of their elderly loved ones.
We have to learn to cherish our elders. I think the caring aspect, we have lost it over the years, and we need to regain that. I remember growing up as a child, I had to go and visit my grandmother, comb her hair for her, and sit and chat with her. This is what we want to see be re-established, that the younger generation has this link with the older generation, and that they grow up knowing their older persons, not being afraid of them and calling them sukuya. All right? We want them to learn to cherish the older persons. Sit down and listen to them, because they have a lot to tell us and a lot to say to us.
Toussaint was not the only one who noted Marie's good health. Honorable Justina Charles, in her remarks, also complimented the family of the centenarian for their efforts.
I just really want to say thanks for all those who continue to work with her, and as the parliamentary representative, I will continue to work closely with you to ensure that she can receive the care that she received. And it says to us that when you do that, it eases up the pressure on, let us say, the Yes You Care program on the government, because you are doing what you are supposed to do. And we just want to commend and ask other persons to emulate, to copy the things that you are doing. As Mrs. Toussaint said, you can see evidence of somebody that is well cared for. So we want to encourage other persons to take charge of your grandparents, because I say to some people, whatever you do today will reflect on your life tomorrow.
Minister for Social Services, Honorable Gloria Shillingford, called Marie a blessing to her community.
Having a centenarian in your community is a blessing. Many persons will be coming to your community to find out who is the centenarian, what has happened. You must have been doing something well.
The new centenarian was showered with gifts. Gift baskets from the Office of the President, the Government of Dominica, the Ministry of Social Services, the Ministry of Culture, the DCOA, the Grand Bay Village Council, and the list went on. Although she sits in a wheelchair, Marie Angol is alert and well aware that all the gifts are hers. The Government of Dominica, as done with all centenarians, will provide a monthly allowance of $500 towards Marie's care. Her utility bills will also be taken care of, and she will receive free cooking gas, compliments Petrocarib. GIS congratulates Marie on her 100th birthday. Reporting for GIS News, I'm Kimani Serja.
Thank you, Kimani, for that report. Moving along, there were dozens of happy faces in the community of Silver Lake on Monday as Christmas cheer and many gifts were delivered to the children of that community. LIAT and the Foundation for the Development of Caribbean Children, FDCC, partnered for the first time this year to bring gifts to children of various communities across Dominica who are part of the Roving Caregivers program. Operations Manager of the FDCC, Clive Murray, expressed his happiness with the opportunity to partner with LIAT in this initiative.
Very, very, very grateful for the opportunity to be able to be partner with LIAT, the Caribbean airline, in this giving back activity, this giving back event. We started this partnership with LIAT in 2012, and so far we've had 1 year of operations where passengers traveling on LIAT flights are asked to donate spare change to the work of the FDCC and to the operations of the Roving Caregivers program. And so far, over 1 year, we've raised over, close to $14,000, and we thought that it was necessary to come back to the communities and give back to the communities and the children of the Roving Caregivers program.
Representative of LIAT, Luana Haywood, was also present to give gifts. She too expressed LIAT's pleasure in partnering with the FDCC in bringing Christmas cheer to children across the Caribbean. The LIAT representative shared her passion about the importance of giving back.
We have seen so many children this afternoon, and I know that's just in a drop in a bucket that we have seen, but it's our great pleasure to be here. Our next plan, we are planning to go to St. Lucia That's our next stop on Friday. And on Monday next week, we'll be hitting Grenada. So we want this year to make sure that we give back, truly give back to our children. Because a lot of times in the Caribbean, you know, you find that people, it's all about them. You know, and it's time that our Caribbean people realize it's time for us to become a nation and a Caribbean people who are willing to give to others and give forward.
Child Fund Caribbean, through the Roving Caregivers Program, has been working in several communities across Dominica, including Silver Lake. The work of the program includes child stimulation activities, parenting, and income generation activities. Jelena Fontaine is the operations manager of Child Fund Caribbean. She thanked LIAT and the FDCC for their partnership in giving to the children.
Child Fund is very grateful for this partnership, this new launching of partnership that FDCC and LIAT are doing for the benefit of our children in Dominica and in the other islands of the Caribbean. We look forward to working with FDCC more on promoting RCP and RCP methodologies within our island and support to the wider region.
Children in the communities of Marigot, Sinaku, Castle Bruce and Warner are also set to receive gifts from this LIAT FDCC partnership. On Sunday, Child Fund Caribbean will bring to the People's Park over 300 children who benefit from the Roving Caregivers Program. They will receive more gifts from the LIAT FDCC partnership. And that's the English segment of the news. McPherson St. Luce is next with the Creole highlights.
Allô tout le monde, bienvenue à cette nouvelle en créole. Non moins, c'est McPherson St. Luce. Premièrement, le gouvernement Dominique tapé assistance OES pour augmenter le registre civil. Si l'on registre Ozzy Walsh, toute information qui a besoin à cet ordinateur.
OES a payé 6 moun pour 6 mois. L'argent OES. Mais il y a travaillé avec le gouvernement Dominique pour faire civil registry plus meilleur. So nous pas que anini certificates ka computer ka bas certificates easy, mais information qui a sur computer pour bas information il qui pli. So nous connait tout le monde qui mort. Dominique ça a computer déjà. Tout le monde qui fait Dominique ça a sur computer déjà. Tout le monde qui marié Dominique nous avons peut-être tout ça sur computer. Avec tout le monde qui vient à l'autre pays, vient adopter les affaires ici, toutes ces informations ça sur computer. Et nous avons fait tout bagage certificat, nous avons fait easy via computer.
En la nouvelle, Social Security Dominica a continué à assister organisations en Dominique, et spécialement saison Noël là. 12 organisations charitables recevront assistance de l'institution à Jardin. Si l'on directeur Janice Jean-Jacques Thomas, il y a une responsabilité civique en pays là.
Chaque année, nous avons fait, mais l'année ça, nous décidons de faire bonne Noël pour aider à porter joy pour ces gens-là qui ont différentes places là. So, on peut observer que ces places qui ont occupé gens qui pas de monde pour occuper yo, gens qui pani. So the less fortunate, enfants, senior citizens, avec nous en institution, nous ni ces gens là à chez nous avec tous les années nous les faisons aider ces gens là qui ont occupé yo pour faire une meilleure vie. Esprit actuellement là nous célébrer Noël avec nous changer Jésus-Christ avec ça Jésus-Christ les nous fait pour garder pour monde qui less fortunate. So malgré c'est temps ça là c'est temps les nous pour garder comment nous dépenser l'argent. Nous tous les années nous fait certain qui nous mettait quelque chose pour passer monde là.
À la nouvelle, ministère santé Honorable Julius Timothy qui a fait parole qui est payé assistance People's Republic of China. Plan pour l'hôpital neuf en Dominique qui continue l'année prochaine. Honorable Timothy aussi mentionné le travail qui prend place à présent pour transformer vieille occasion et puis ça c'est l'occasion on a eu de mettre monde qui parle de tête à un centre moderne. Ministre Timothy fait parole aussi qu'il y a un oncology center qui parle bonne l'année prochaine, équipement qui sortira de Ross University. L'occasion, c'est là, si le ministre Timothy, qui a une opération par finissement janvier pour février l'année prochaine. Finalement, le cabinet Dominique mettait mis en place un comité qui caille en charge l'occasion des enfants en pays. Parole celle-là sortira du ministère de l'Éducation, Honorable Peter Saint-Jean.
Cabinet Dominique, nous discutons Early Childhood Development et nous faisons un plan qui, si le pays a, nous pour travailler ensemble pour éduquer ces enfants. Et en décision ça là qui cabinet approuvé, nous a créé, nous a formé en ces différents villages là, ça nous a créé un preschool development committee. Ça c'est un comité qui est différents monde qui travaillent en santé, nurse, monde qui travaillent en éducation, monde qui fait travail social et aussi ces parents là, nous a mis comité ça là en place pour manager ces l'école là en ces différents villages là puisque nous travaillons ensemble qui nous ouais programme ça là il est là pour longtemps.
Messieurs mesdames, ça c'est tout pour nouvelle créole pour à présent. Non moins c'est McPherson Luce. Ni au bon saison Noël. Au revoir.
Coming up next, your tip of the day.
Do you have uncovered water storage drums around your home? Do you dispose of old tires, cans and old containers capable of holding water anywhere in your environment? Are you being bitten by mosquitoes, particularly at dusk and early morning? Do you keep houseplants in water? Do you spend your hard-earned cash to control mosquitoes? Has your community experienced dengue fever outbreaks? If your answer is yes to at least 3 questions above, you are at risk to dengue fever. Join the fight against dengue fever. The responsibility for a dengue-free Dominica lies with you. So, get rid of the Aedes aegypti mosquito.
As a Libra, my sign is the scale, which signifies balance. I'm not sure how much my sign plays into my desire to live a balanced life, but I do know that the more balanced I feel, the more free I feel. In my work, I'm often reminded that what works for some people does not necessarily work for others, and that one person's idea of balance may not constitute anything remotely balanced from another person's perspective. So try these tips to help you live a balanced life. Take some time to really look at your life, your state of mind, and how you're feeling. Be honest with yourself and notice the areas of your life that you're neglecting. Notice if you're leaning more toward an internal or external focus, or if there are areas within your life that you would like to be more balanced. Make a list to help you decide in which ways you want to balance your life. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm. On behalf of the entire news production team, I'm Pearl Fontaine. Thanks for watching.